Thank you, Ms. Jacques. And actually, you can stay up here. We're going to open the floor up for questions. I can invite Ms. Happy back up here. Okay, yep. Does anyone have a question for one or both of our presenters? At the back?
I really loved your presentation, learned a lot. And we do a lot of work with young people in the Black community. And I don't want to say, obviously, this isn't a conversation, but it's clearly not a conversation. Do you have any suggestions for how to bring this conversation to young people, or any resources that you would recommend?
Yeah. So are you specifically talking about HIV or? Yeah. So that's
like that health promotion lens, something to at least get it on radar.
Yeah, definitely. So I do have a couple of suggestions. And within the first presentation that I gave, funny enough, within our data set, it was the younger people. So between 18 to, I would say, 25 that really wanted to share their stories. They're just like, we have no time to be hiding this. But as we started to get to the older, I would say more mature folks, it was all of this hiding and shame. So it was just interesting to see that a lot of young people want to be open, they want to share. And so there's tons of different resources out there. I mentioned one of them, our critical health and racial literacy program on our Concurrent website is steeped first in the social determinants of health, which I talked about a little bit. And we have some disease-specific modules on HIV. So that's definitely a good place to start. We'll be launching a peer equity navigation program where it will be focused specifically on HIV and how to educate the community. So if you want to talk to me after, we can definitely talk about that. So this is another way for young people to actually be part of the movement, because it's one thing to be educated and have the knowledge. And I'm sure within your tight circle, you may share, I did this module, it's great. But it's another thing to move that knowledge to your community so that people can feel more empowered. So that's another source. If people are wanting quick courses, there's the Caddy courses as well online. But there's definitely I would say an emerging set of modules that young people can get involved with. We're also going to be doing a World AIDS Day event at Co-Create Lab, I believe December 3rd, where we're going to have young people and anyone who wants to come to talk about the theme for this year. So how to end HIV stigma, right? Because that is one of the pieces that, if it's not addressed, this is something that actually kills. We can't necessarily see it, but it hinders us from so many different access points. Yeah. Yes.
Thank you, merci. Pick up on the stigma piece. I'm struck that across all three presentations, stigma is an important topic regardless of the disease. I have a question for you. How did you overcome the stigma to participate in research? Because obviously you were very successful, and Islande will be recruiting members of the community for her thesis. So what can we learn from that?
Yeah, so that's a great question. And honestly, I have to say with particularly the first study, I wasn't involved in the research activities of the second, but particularly the first one, it was very humbling for me because within the ACB community, it's made up of multiple communities. And so within that, there's different levels of conservatism, as well as pushback and resistance. So for example, within the Caribbean communities, they don't want to even have this conversation, whether it's in a church space or in their homes, they're like, no, don't want to have it. They don't want to be associated with it. So it was very, very difficult. I tried recruiting from my church and everyone saw me as a research lady. No, I don't want to talk about HIV. Don't want to have it. So I was able to just get a handful of people who were around my age group, but the older ones, not so much. So I would say you need to actually have a strategy for different communities. So for the Caribbean community, I would say you have to really build relationships. That's really where it starts. They have to know you, trust you, who are you, what you're going to do with the data. So some of the things that we've been talking about in terms of breaking down the stigma is really letting them know about research. Research is really being curious. You're curious about a topic, you're curious about a particular population, and we just really want to know, how do we answer this question? I can't answer it by myself as a researcher. So collectively, so using that CBPR lens, we have to answer that question. And if we work together, we can definitely find answers. So that's one. I think the second is really letting the community know that they have agency. So you also have the answers, because oftentimes, and this is a theme that came up within our presentation, was that within the biomedical model, it's often the doctors are telling you what they think you should do or how you should handle your body, and to some degree that's true because they have a level of expertise, but there's also expertise in the lived experience. And so we try to arm our participants with that knowledge that you're part of this process and your lived experience is just as valuable as, a report in a journal. And so that piece is also very important. So building that level of empowerment and agency. And then I would say on the flip side, there are some African communities that we connected with. They were very open, just wanting to talk and ready to, be part of the whole chain. So I would say, for communities that are very open, like attaching yourself to community associations, so like Senegalese Association or Cameroon Association, like they already have open forums and events where they talk about some of these things. And you coming in as a researcher, you can help to share their stories, right? And amplify their stories. But I would say starting with educating them on what is going to happen with the data, what is research really, and the fact that we all do research in different ways every day. We all have questions. We're all curious about something. Where do you go to find the information? How do you break that down? So I try to use like just basic words, to align with their everyday experience. Yes. And I also had a question for you to just kind of piggyback. How did you tackle, stigma as well as participation of ACB or Black Canadians within your study? Because I do know, especially when you're dealing with something as terminal as cancer, there's even less openness to wanting to participate. So,
do you want to answer?
So this was a scoping review, so we haven't started working yet with participants, but are hoping to. And this will be a project with Dr. Edouard, Dr. Marianne Chebian here. We are aware that there'll be a taboo, interesting enough, about young people. So I'm aware of a group in Toronto that has done focus groups and qualitative studies with women with breast cancer in the Black community there.
Yeah.
Young women participated. Yeah. Getting older women, they said much trickier also to want to talk in general about their experiences. So I think it's possible, but some subgroups are harder to reach. Yeah. For example, they had a hard time getting francophones. So that will be an interesting avenue for us.
There are two agencies. So I know Women's College Hospital.
Yes, that's them. Yeah.
Yeah. And then there's Olive
Branch of Hope.
Yeah.
As well. Yeah.
Those two are very big on that.
Yeah.
Yes.
Well, thank you for your talk. I'm sorry I missed yours. But I just wanted to know for the HIV study, did you see any difference between the population, which was newcomers versus those who have been long-term immigrants? Because HIV has been around nearly 60 years. Surely we don't do as much awareness as we used to do. Of course, it's not. Your issue is that it's not targeted to the right communities in the right way either. But did you see any difference, whether they've been here just recently or been here for a long time?
Yeah, definitely. So I would say the newcomers, and we're writing so many different papers around the different themes, because I think we do need to have a paper on newcomer experience. One of the challenges that they've found was that there's this assumption that, when they come to Canada, that they know the system, right? It's universal healthcare, boom, done, go find out where to go for a doctor. And so one of the main challenges that they mentioned was they had no idea where to go. You know, they had no idea how to obtain a health card. If they did have if they traveled and they knew that they had HIV, they didn't know what AIDS serving organizations to go to. There was no kind of resource or centralized area to go to unless they were comfortable enough to share within their social network. So access to resources was very, very limited, just based on the assumption that, oh, you should know how to go to your doctor and navigate the system. Similar challenges with people that are more enmeshed, like immigrants that are more enmeshed in the system. They actually knew where to go, but there's still that level of shame and silence. So even though they would know, okay, there is ACHO, for example, AIDS Committee of Ottawa, I know where to go for that. They're not necessarily sharing that within their network, right? So again, the issue of stigma is so prevalent because we're seeing that it limits access at different levels. So in summary, for the new immigrants, it limits them from the onset. They have no idea where to go. But for the ones that are more enmeshed, they may know where to go, but they're not necessarily sharing that information because of the stigma that's associated, or because of the discrimination that they face. You know, when they go to the doctor, doctors don't necessarily want to touch them, or, you know, there's this kind of barrier or wall in that kind of interpersonal relationship. And then you don't necessarily want to go and tell your family members that you've had this for how long and you haven't told me. And so it's quite a multifaceted issue.
I'm just wondering, in terms of focus group, did you like mixed people from like community leaders or patients and medical professional? Did you like mixed together, or did you like a group for HIV patients?
Yeah, that's a good question.
And another like professional, healthcare professional? Did you like do separate?
So I would say for the first study, that was focused on HIV stigma, we separated the groups. So we had a group with just CAD women, because as I mentioned, we don't have a lot of literature where we're hearing just from them. So we had specific focus groups set up through the AIDS Committee of Ottawa, which is one of our research partners, with just CAD women. And then we had a separate group for just leaders in the community, because we wanted to see if what were some of the themes. And so for some of the leaders, some of the themes that came out was that they don't have even spaces to talk about this, right? Some of them, it was the first time that they were having an open discussion around HIV, right? Versus the women that were already entrenched in like a AIDS serving association, they knew where to go, but they were still having challenges around access and around even sharing their stories. As I mentioned, the younger ones were more than willing to share their stories. With the second study, it was a mixed group. So we had researchers, patients, it was a mixed bag. Yeah. Yes, you're welcome.
Any more questions? Pretty good timing. We are transitioning to the lunch hour. Okay. So thank you so much, our presenters. Last round of applause.